How is it? What did the doctor tell you?
That he had, it was uncertainty, but he had a feeling that it was Hodgkin's lymphoma. And he said, he explained to me that it's curable. He said that, I mean, I was nervous just by having, diagnosis of a cancer. So, but yeah, he just told me that it was going to be okay. I mean, he reassured me.
It will be. So, but the one problem, did he explain this to you, the oncologist, or the infertility?
Yeah, it was actually a question that I had gone into the office. I had written down because someone had brought it up to me that there was a possibility that I could become infertile. So it was definitely a question I wanted to ask him the first meeting I had with him outside of being in the hospital.
So you really brought it up?
I did.
That's usually the case. Unfortunately, the oncologists are so concerned about saving your life that they often will forget to counsel the patient on her infertility, not realizing that most women want to have a child.
Right.
Whether now or 10 years from now.
Exactly.
They want to have and often the oncologists are, particularly the males, are just not aware of it. And so it's good that you asked. We have to have, and one of the reasons I'm doing this interview with you is we'd like to promote more patient awareness. Because if you ask the oncologist, well, they'll say, oh yeah, well that's right. I mean, if you want to preserve your fertility, I guess that can be done.
I didn't actually know a lot about it. I mean, I knew about eggs and stuff, but I didn't realize you could preserve an entire ovary.
Yeah,
it's crazy.
This is fantastic. Really.
It is.
So what would happen is with the treatment you're going to get, it's even possible you're going to become menopausal at first. It'll kill all the eggs in the remaining ovary. But it may not kill quite all of them. You might even have a recovery of some cycles. But the point is, it would kill so many of them that you would either use sterile right now forever, or you'd only be fertile for maybe a year or two or three.
Wow.
So that's why we want to save the other ovary.
Right.
It's pretty uniform that it's going to kill all those eggs. And the idea of saving the ovary is we can do a very small incision and freeze it successfully and then transplant it back through a very small incision. It's not a big operation. I mean, the way we started out doing it in 1997 was a big operation. But now it's pretty simple. We really simplified it.
Right. Yeah, especially since it's a same-day surgery.
Yeah, exactly.
That's crazy.
And, many of our patients 10 years later say, we're so grateful that I had cancer, they say. I say, why? Are you crazy?
Right.
And the reason is that all their girlfriends, by their 30s, that's all they're talking about is their biological clock.
Right.
And the cancer patients, they don't worry about that because they've got a 23-year-old ovary or sometimes a 17-year-old ovary.
Wow.
In the freezer, and they're just not worried about it one bit.
In the freezer.
Yeah. It's not really a freezer.
No, I know.
Tanks. But so that's an advantage. Is that I could almost offer this to any woman who's worried about getting older in her biological clock as a way of preserving her fertility. But you don't do it because it seems too extreme a measure. Maybe it isn't though. Because all of our cancer patients are grateful that they had cancer, because otherwise they wouldn't have preserved their fertility. and at 35, they could be very infertile without having had cancer treatment.
Yeah. I'm very thankful for this.
Yeah, that's great.